is all of our people being vaccinated. And, you know, it's always just an honor and a privilege to be standing with my leadership here. And of course, we are all a team in this effort. But when we stand, you know, before you all, and that is the public, to say that we're doing good, you know, and we're doing well because people have demonstrated civic trust, and they have been doing the right thing to get us where we are today. As of yesterday, there were 28,782 cases, COVID cases in the city of New Orleans over time. 769 deaths in our community. Our positivity rate as of today is 1.5%, one of the lowest in the state of Louisiana. The numbers are what they are, as I said at the start of this, because people have been doing the right thing and we've collectively been putting in the work. We're also the #1 in the state, meaning our city, in getting our people vaccinated. That is a huge win, and it's something that we all should be proud of, but continue to promote, because again, this is our way of getting back to the city, you know, doing the things that we love to do in our city and of course with one another. We're 21.4% of Orleans Parish has received at least the first dose of the vaccine, with nearly 12% fully vaccinated. As of yesterday, I received my second dose, and I'm feeling good. My arm is actually not as sore as it was with the first dose. And, you know, you never know. It hits people differently, but it has been a very good experience. And I just want to encourage our people to continue to do the right thing, as well as to get vaccinated. We're on such a good track and really in a good spot to continue to ease restrictions. So we're going to move towards a modified phase 3, which will go into effect on Friday, March the 12th. And Dr. Vegno will get deeper into on the vaccination side as well as the easements. But we are moving to 75% capacity across the board for restaurants as well as businesses in our community. The gathering size limits will be 75 people indoor, 150 people outdoor. For St. Patrick's Day, and there will be more to come on this as well as we move closer. But what we do know for St. Patrick's Day weekend, there will be no parades, and all block parties will be prohibited. We're working with our businesses on this as well, and in a collaborative manner. So again, that we stay on the right track in our city and follow the guidelines that will not move us in the wrong direction, but embrace those guidelines that will continue to move us in the right direction. And I'm pleased with the work that's been going on with the businesses. We know that we've been, again, here before, and so we don't want to regress. We want to keep on making progress. The mass vaccination site, as you know, that we've stood up. Right now, it's open 3 days a week, but soon, once J&J comes our way, Johnson & Johnson, hopefully within the next couple of weeks prior to the end of March, we're looking to stand that up every single day in the city of New Orleans. But what we're so proud of and what we've seen just at our site is that the majority going and getting vaccinated are majority African American residents in the city of New Orleans. Again, being intentional, we know that this COVID-19, this pandemic, hit us at a deficit, and of course, being highly populated in terms of the most Afrocentric city in the United States of America, we want to continue to demonstrate that our people, those who are most impacted, disproportionately impacted, are again the first in this effort to ensure that our people are getting vaccinated and making us safer, making them safer, and getting us to a place where we can ease restrictions in the city of New Orleans. So what I will do is to encourage you, we'll always do that, But call 311 to get on the wait list. You will get your appointment scheduled, and we'll take it from there. So without further ado, I'm going to ask Dr. Vegno to come forward, give us more details in regards to the vaccinations, and we'll go into Q&A after that. Dr. Vegno?
Thank you, Mayor. I'm glad you're feeling good after your second vaccine. That's exciting. It's been a while since I've done a data presentation, so I thought it would be good for a reset. And of course, these slides will be available afterwards. Next slide, John. So it is 1 year and 1 day, as everybody knows. And this is the story of a year right here. We've gone from that early hotspot that you can easily see to prolonged mitigation with recurrent, what I would call ripples of surge. And you can see what those are attributed to. But in the last month, our new cases have continued that steady decline and are back at that really comfortable spot in that zone of 1 to 10 cases per 10,000, that's case incidence, that national experts agree indicates low to moderate transmission. Next slide. Orleans Parish, as you can see, we're in yellow, above us, the little yellow triangle above the lake there. It is one of the lowest risk communities in Louisiana, but we are surrounded by neighbors that continue to have worse outbreaks. And those are, as you can see, are scattered throughout the state. This is our year-end data. We have tested in a year, actually less than a year since we started really testing, almost the equivalent of twice our population, which is tremendous. And that testing continues. It has not gone away. There are still multiple options. What we know now about how deadly this is that of all the cases we know of, and again, we are very aware that many cases are asymptomatic and undiagnosed, but of the cases we know of, about 2.5% of them result in death. That is a very high number, even when we take into account how many asymptomatics there might be. The highlights are our positivity rate and our current cases per day, and that's where we want to be. We've been there before. We want to stay there for the foreseeable future and beyond. Next slide. What we're balancing right now as we open up restrictions is the improvement in our numbers while watching the spread of those more contagious variants. The CDC has come out very strongly multiple times in the last week, urging state and local governments and authorities to refrain from opening up too much too soon. And I think you just have to look to history in the last year to know what happens when you open up too much too soon. Those are hospitalizations and deaths that can be prevented. And so we appreciate their guidance on this matter. We know that 50% of the confirmed variant cases right now in Louisiana are in the New Orleans region. The graph that you see is just showing you how quickly those variants spread. You can see this is US, this is not Louisiana, but you can see our cases nationwide have come down from that terrible holiday peak, but they've plateaued in the last several weeks. And as they plateau, you see that B117, which is commonly known as the UK variant, not the only one, but it's the one we have most data on, see how quickly those cases are rising. That's what happened in the UK, is that when that variant began to double and spread so quickly, it stopped the recovery that they had made in terms of cases. So just that's a visual of what we are using to make this decision. And we are acutely aware of our social vulnerability. There is an index that's used by the CDC. It's widely available online. And we rank highly on that index, meaning that our residents are more likely to experience severe physical and economic harm from COVID-19. So we cannot ignore that as we move forward. Next slide. So for these reasons, the health department has recommended and Mayor Cantrell has agreed that we move into a modified phase 3, largely in line with the state, but with some additional restrictions in higher risk settings. The high risk settings are the same as they have been. Small to larger, uncontrolled gatherings where people are mingling, intermixing, letting their guard down. It's exactly the same as it's been for quite some time now. Starting Friday at 6 a.m., retail stores, restaurants, salons, movie theaters, museums, offices in Orleans Parish will be allowed to increase to 75% capacity with social distancing and masking still required. That does not go away for any sector. That's in line with the state. Also in line with the state, bars and breweries, 50% capacity indoors, since we are below 5%, that's the qualifier. Gyms and fitness centers stay at 50%. Concert and music halls can go to 75%, but with a maximum of 250 people. That is a state requirement. And these are places with fixed seating. So a theater that has seating that does not move, not an open space that you put chairs in and have music. There's a distinction there, clearly in the state. And then per the state, our conference venues remain at 50%. What we are keeping more restrictive are our gathering sizes. Again, we have just moved the gathering sizes from 10 to 75 indoors. We still believe it is prudent to keep them and to watch the progression, to see what's going to happen with the variants and to see how safe. 75 is a lot of people indoors and 150 people outdoors. Our sporting venues, we just increased as well, so they're going to stay the same as they were last week. Our houses of worship are going to be 75% capacity with masking and distancing. They have always been in the same category as things like theaters because it's the same principle. It's a fixed seating. You come in, you have an event, you sit, and you leave. So that's why they're going to say the same. The event venues, as always, follow the gathering sizes, as do fairs, festivals, and carnivals. Live entertainment is also going to be allowed in accordance with the state fire marshal published guidelines. Now, this is exciting, but these are very nuanced, very detailed, very specific requirements. So I urge everyone to really read over them carefully before planning an event. There are very specific requirements for your HVAC system and where people are going to be sitting and how it's going to be done and the type of instruments. So this is not a free pass. It is to keep our performers safe and keep our customers safe as well. Next slide. So let's talk a little bit about vaccines, because I realize we had not really done this in a press conference. We have done many, many town halls and meetings and presentations since December on vaccines, but certainly we want the public to have all of this information. Vaccines are our way out. There are 3 highly safe and effective vaccines, and I've got a slide next which shows the differences between them. But the important things to remember are these vaccines were developed using exactly the same guidelines and procedures that every vaccine has been developed by the FDA. I think there's a lot of misinformation or confusion about, well, how did this happen so fast? The technology that these vaccines use has been in development for years, if not decades. What the difference is that the pouring in of resources to get these vaccines tested is something that just doesn't happen absent a pandemic. So that's what takes years and years to do, is to get the resources, the funding, the trials set up, to see that these vaccines are safe. When you have every country in the world looking for a solution, you're going to get a lot of resources. So all of the procedures were followed strictly according to the FDA. The FDA is a scientific body. It is not an arm of one government or another, whether it was the previous one or currently, that gives the rubber stamps. They have established procedures for approving vaccine. Every one of them was followed. I can tell you personally, I read through every briefing document for all 3 of the vaccines, as did many of my colleagues. Nothing was any different than it normally is. And then even after that, there is a separate scientific body that looks at the vaccine recommendations and prioritizes who should get it first. We do not. Even with Johnson & Johnson right now, we do not have enough supply to meet demand. So there has to be some hard decisions about who should be prioritized. And that is what this independent group does. And then the states take their recommendations. And I will say the state of Louisiana has followed very closely to the recommendations that they've been given by the CDC, which is exactly what you want. Next slide. So we have 3 effective, safe choices. And it is a false sort of question to say which one is better. They are all home runs in terms of vaccine. As you know, Moderna and Pfizer were tested as 2 doses, so they're given as 2 doses because that's what we know works. To date, at least 60 million people have gotten one of the doses of Pfizer and Moderna, and of course Johnson & Johnson, I think they pushed out maybe 2 million last week, so millions and millions and millions of doses given, and we're not seeing anything different than happened in the trials that had tens of thousands of volunteers, which is phenomenal. Moderna and Pfizer, every one of them, is 100% or very close to 100% in preventing death and hospitalizations. That is what counts. No vaccine is 100% against a disease. And, I give the example, my daughter has been fully vaccinated. She was vaccinated against chickenpox. Last year, she got a mild case of chickenpox. Why? Because that vaccine is 90% effective, and she was in the 10%. She had a much milder case than I had as a kid when I had chickenpox. But, she still got it. She was in that 10%. So no vaccine is going to prevent 100% of disease. But what you want is it to prevent 100% or close to it of severe disease, hospitalization, and death. All of those do that. Johnson & Johnson sometimes gets a rap because the trials showed 72% effectiveness against any disease. 72% is pretty darn good. The other advantage that Johnson & Johnson has is that it's just 1 dose, and the trial happened when all of the variants were circling. We don't yet know how Moderna and Pfizer are going to work on the variants, although we're getting growing evidence that they will protect against it. But we know that Johnson & Johnson has pretty good protection, particularly against the British one. So trying to say that 72 is not as good as 95 really is a false argument. All of them are what I would recommend my family members to get when it is their turn. They all have very similar side effects. Some of them have varying degrees of side effects. You've heard many stories about people getting side effects after their 2nd dose. Fortunately, the mayor didn't. Fortunately, I didn't. But they're real, and they do happen. They are minimal, and they do not last long. We do not have any reports of people dying because they were administered a vaccine. And let me tell you, we are looking for them. So out of 60 million doses, that's a pretty strong track record. Next slide. So let's talk about who is eligible currently in the state of Louisiana. We were very excited to see this change yesterday, 2 days ago, whenever it changed. Everyone who's elderly. Why? Because they're the ones who have suffered and died the most. Easy, end of story. Really exciting is that the governor opened eligibility to those 16 and older with medical conditions that have been identified by the CDC as high risk for severe disease. And that's going to be a lot of people in New Orleans because it is people who smoke, people who are overweight, people who have high blood pressure, diabetes, cancer, heart disease. Unfortunately, our city has a large number of people who fall into that category, but this means now they can get protected before those who are young and healthy and probably would be fine if they contracted coronavirus. We also have it designated for high-risk occupations, of course, healthcare workers. Our school staff are probably going to be done with their 1st doses this week. That's tremendous. And just a ringing endorsement of the fact that it is really good we have schools open. Our congregate living staff, and then, there's some others. Please know that although we were thrilled that the state opened up eligibility, we still do not have the supply. We still are having some supply chain issues that come up. Johnson & Johnson is not shipping doses nationwide probably for another 2 or 3 weeks. They sort of pushed out what they had after they got approved. They're ramping up production. We've been told by them to expect regular deliveries end of March, 1st week of April. When that does, it's going to really help our supply, but it's going to take time to get through the hundreds of thousands of people that are now going to be eligible. So if you are currently eligible, it's okay if you don't get it tomorrow. We will get it to you as quickly as we can. Next slide. So as the mayor mentioned, this is taken from data off the LDH website. You just have to divide by our population. And the US is taken from the CDC website. We have initiated vaccine in Orleans Parish on over 21%. Which is phenomenal, and it speaks to our providers, because whether you're a healthcare system, an independent pharmacy, an FQHC, one of our sites, our homebound delivery, we are hustling day and night to get vaccine to arms. We are doing it through all kinds of partnerships, going door to door, every method we can think of, and I think that shows results. We are close to 12% fully series. That sounds great, but remember, public health experts believe we need to get to at least 75% before we have sufficient immunity to return fully to normal. That doesn't mean that we're going to never have a case of coronavirus again. We're not trying to get to zero. What it means, we will have far few outbreaks, serious cases, and hospitals will not be overwhelmed and people will not be dying in the numbers, anywhere near the numbers that we've seen. So we've come a long way, but we still have a long way to go. Next slide. So in order for us to fully return to normal as a community, we have to provide access and information so that everyone feels comfortable getting vaccine. If only some neighborhoods or some groups get 75% vaccinated, we will not win this war. We know that COVID, like much of our society, has had disproportionate impacts on our residents of color. You can see that Black residents make up close to 3/4 of COVID deaths in Orleans Parish. They are 60% of the population. Right now, they are only 45% of our series that have been started. It is imperative as a city that we ensure that those at highest risk of death have ample access to the life-saving intervention that is a vaccine. So how are we doing this? It is about removing barriers and providing education. We are working with our community providers, everyone who gives vaccine, to understand who they're vaccinating, who they're not vaccinating. That's FQHCs, that's our health systems, that's everyone that is on our regular weekly calls. We're using our citywide wait list to share with those providers residents seeking vaccine with those who have available doses, so we can make that match as much as possible when vaccine is plentiful. So like our community testing program, we've put vaccine sites in key neighborhoods, and we've worked with partners to do the same. There are other partners who are going into neighborhoods so that residents in need do not have to go far to get their shot. I do want to highlight that vaccination logistics are far more complicated than testing sites, so we're not able to have that variety of rotating sites that we've really been used to, but we are doing our best to reach every corner of the city. So far, we've been to or have events planned in Central City, Lower 9, West Bank, 7th Ward, Holly Grove, downtown, and several others. Similarly, we're making it as easy as possible to get to the mass vaccination site. RTA provides shuttles for free from 3 key hubs in the center for anyone traveling to the convention center to get vaccinated. Over 140, I think, residents have already used that service, which is fantastic. We're working to bring a rideshare pilot to New Orleans, so anybody who needs a ride to a vaccine can get one. In partnership with EMS and fire, we're reaching our most vulnerable homebound residents who would have no way to get vaccinated otherwise. If you or a loved one needs this service, if you are homebound and cannot leave your house, please register on the wait list, indicate you need homebound, and we will reach out to you to schedule. And we are bringing education to the community. We're going door to door with community health workers, volunteers, local service organizations, answering questions, finding out what people are confused about, hopefully clarifying misinformation, understanding what the needs and concerns are on the ground, because the goal is to leave no one behind. Next slide. Just a couple of questions. I'll go through these really quickly that are sort of the greatest hits of what comes up. Who should or shouldn't get a vaccine? Everyone, unless you have a specific allergy to a specific component of a vaccine, you are qualified to get a vaccine. In fact, if you have serious medical conditions, heart conditions, asthma, you absolutely should get a vaccine, because your risk of dying from COVID with those conditions is far more likely than you're going to have any problem with the vaccine. For information that we need when you're signing up, we need basic demographics, and that is because we have to put you in the state immunization system that's required every time you get an immunization. So we do need to know the who you are and demographic so that we can match you for your second dose, right? If I put in Jenna Vegno on one and then I put in Jen Smith on the second dose, then it's not going to know that I've received both doses. Vaccines are free. And the only reason we need information, or you might be asked about your insurance, is at some point insurance companies might pick up some of the costs, but it will never be passed along to you. So if you get asked about information, it is not because someone's going to take your information and do anything with it. If you've already had COVID-19, yes, you should get the vaccine. We do not know how long natural immunity lasts, and there is a lot of evidence that it might wane pretty quickly. The vaccine immunity seems to be added protection. You should talk to your doctor about the timing if you've had it recently, but if you've had it, you should get the vaccine. I think I answered which vaccine should I get? Any one that is available. I know that there has been a lot of media about the Archdiocese coming out and saying, maybe get one over the other. And I was fortunate enough to have some lovely conversations with the Archbishop, who has come out very strongly and said he believes it is moral obligation to take the vaccine, and that he wants folks to understand that is his message, that it is an act of charity, and that is his message.
We're aligning it with the Holy Father.
Yes, as we are both Catholics up here. So I know there's been some discussion about that, but he wanted me to relay that his intent was to encourage people to get vaccine, and anyone. How long do side effects last? It really depends on who you are. Most of them are very quick, 6-12 hours, not more than 24 hours, and they're mild, or they just sort of knock you down for a day, and then most people say, I got up the next morning feeling like Superman. We're hearing a lot of people say, my immune system is strong, I'm young, I'm healthy, why do I need a vaccine? I'm going to be fine. And that might be true. Maybe if you are young and healthy, you're likely to get a uncomplicated case. It's not always the case. We have seen plenty of young people who have died from this with perfectly healthy immune systems. We also know that if you get it and you feel okay, you still can pass it on to someone else whose immune system is not as strong. We all need to build herd immunity. It's not just the weak ones among us. Next slide. This is something that's come out recently by the CDC. So how does life change for the 12% of us that are fully vaccinated? Not a whole lot is the answer. And again, because we still don't know if we can transmit a mild asymptomatic case to our loved ones who have not been vaccinated. What the CDC is saying is that if you are fully vaccinated, you have to continue masking, distancing, all the guidelines outside your household. You may visit with other fully vaccinated people indoors in small numbers without masking or distancing. We call this the Dr. Fauci clause. Dr. Fauci and his wife are fully vaccinated. Their adult daughter is a teacher. She is fully vaccinated. They can have dinner together in their home and take their masks off and give each other hugs. If Dr. Fauci's neighbor came over, everybody puts the masks back on, everybody goes back to distancing. So that's really, what you can and can't do. Those of us who are fully vaccinated still have to be vigilant and adhere to the guidelines. Next slide. How to access vaccine. Again, we wish we had the supply for all 391,000 of us. We don't yet, but we are getting closer every week. So how can you access it? Call 311. If you don't have a computer, if you're not internet savvy, if you just want to talk to a person, ask to be put on the city wait list. They will put all of your information in so that when we get vaccine doses in, when we're scheduling events, when our providers say, like the mass vaccination sites say, hey, send me the list, send me the wait list, we send it over, they can call, get you off the list. You can do the same thing going online and putting your information in yourself. If you feel like that's a better way to do it, we encourage that as well. If you want to know who else is giving vaccine, every week LDH puts out a list. It is a little clunky to use, but you can go and look at Orleans Parish or whatever parish you want, find those pharmacies. Every one of them has a contact number. So if you say, oh, that pharmacy's right down the street from me, let me call them. That's another way to do it. Next slide. this is what we're getting to. This is what we want to see. You know, Super Sunday would be coming up. And we could see our culture bearers in their gorgeous suits, in their finery. We can only do that if every one of us gets the vaccine and feels comfortable doing it and spreading it to their friends and family. So we're hoping that everyone will go sleeves up NOLA so that this guy can take off his mask. That's a lot. I apologize, but happy to take questions.
No, great job, Dr. Vegno. And so, Ms. LaToya?
Yes, ma'am.
We've given a lot of information.
Yes, ma'am. Our first question, Jessica, the applicant.
I was wondering if both of you guys could speak to the effect that the ban, or the end of the ban on live entertainment at bars is going to have on the city's musicians and our culture bearers, and just allowing them to get back to work.
Now, Jessica, you know that any opportunity, you know, that we provide for our cultural bearers to get back to work, it's a good thing. For them, financially, that economic impact is significant to them, to their lives, but also to the businesses across the board and to the city of New Orleans. And it's not just the economic gain, which is very important, but it's that spirit, though, of the city, I think, that kind of keeps that hope and that momentum strong so that we can get beyond that 75% of our people vaccinated. Dr. Vegno, anything you want to add?
Yeah, and, you know, one thing to temper that is we want to protect our culture bearers. And so that's why, you know, even at the state level, live entertainment is not just sort of back in, you know, large, huge crowds and all that, because that would be dangerous. We've lost enough of them. We were fortunate enough to partner with Musicians Clinic to do a vaccination event for culture bearers last week at the Ashe Cultural Center. That was so beautiful and so hopeful because when they can be vaccinated, again, that means more gigs for them to play as we're opening this up. So we are all really excited about it. We just want to do it in the right way.
And that's always been just, you know, we've always been intentional about ensuring that they're a priority, and we'll continue to do that. Even street performers and the like, they are a priority for the city of New Orleans.
With the city moving into the modified phase 3 on Friday, is the city getting the message out to welcome tourists back?
Well, the city of New Orleans, we've seen tourists visit our city throughout the pandemic, and there is no reason to believe that that would decrease. We're encouraging people to get vaccinated. Those who live outside of, you know, our city, outside of our state, to get vaccinated. When they visit our city, mask up, keep the distance, follow our guidelines. This is something that we have been consistently urging. And one of the things that we're doing as well for the businesses as it relates to the easements coming on Friday, we will be modifying our grant opportunities or programs, you know, we put in place initially it was the streeteries, you know, for those restaurants so that they can, you know, do more outdoor. But we're going to be now pivoting towards now the businesses in terms of live entertainment and the like, to allow for them to get their air condition or the HVAC up to the levels that are necessary to fully operate, or put the shields up if they wish based on how, you know, they want to adhere to our guidelines. So we'll be pivoting our programs to therefore meet the needs of the new guidelines that are in place for the businesses, again, you know, to thrive in limited capacity still, but it's definitely a step in the right direction.
WDSU followed by WWL.
So here's a question here on both of you will answer that has, I guess, a positive air to it here. A lot of times Louisiana and New Orleans is on the wrong side of a list. We're 49 and 50th. But based on these numbers, it looks like we're leading the country in vaccinations and the percent of population. You see the state and national average if you could speak to that and what that says about the city of New Orleans and the people here.
Well, thank you, one, for acknowledging that, because we have been demonstrating leadership in the state of Louisiana and the United States of America from the start. We were absolutely that hot spot, but did what was necessary first to do it, even in the state putting guidelines in place, only for the rest of the state to follow, which is a good thing. So I contribute that to the team that we've assembled, but also the public having and displaying the civic trust to get us to where we are right now. But I think it is important for us to embrace the positive news, for us to be proud of that, for us to continue to showcase that on a national scale, but to the point where our people are hopeful and our people do the right thing as it relates to being vaccinated, so that, again, we can get back to life as we so love to in our city. Dr. Vegno?
Yeah, I'll take a little bit of a different approach. I think this is what you get when you have every provider and all of the healthcare and associated infrastructure working towards a common goal, and you have resources to achieve it. Can you imagine if we had this level of resources to attack hypertension, cancer, obesity, and the shared mission and goal? And I think that's really been the key. And also when we can focus on filling the gaps, right? You don't get to 21% if you do what a lot of other places are doing and say, just sign up online. Come online, or just show up at a drive-through, right? You never get to 20. You might get to 75% in neighborhoods that can easily afford to do that, but you're going to get very few in others. So when you have that really deliberate approach and you've got partners all working towards the same goal, that's what you get.
And the public, in
Yeah,
terms of the volunteers that have signed up to help us, it's been phenomenal. And a part of those volunteers are city employees themselves, who are already carrying the burden of sacrifice of public service, but going that extra mile so that we're all working together towards that common goal.
WWL.
Just kind of a point of clarity on the live music. So what does this mean for something like Franklin Street clubs or something like at Tipitinas or Howland Mall?
You can talk about them.
That's why I said the requirements are pretty strict, and I don't have them all in my head, but there's specific guidance around what kind of ventilation system you have to have, what kind of if there's a barrier, if there's not a barrier, how far away, what the singers have to be doing, what the instruments have to be doing, and so each club institution is going to really have to look at those and then check with the state fire marshal to make sure that they are meeting those guidelines. They're not overly onerous. They can be done, but I appreciate them really taking the time to make sure they're done safely.
But the point being, though, they can, in theory, start this Saturday.
If they have what they need, if they have the proper systems and all that, they can and that they can comply, then yes, they could start.
So complying is the secret
Right.
sauce, but also it goes, along with the city creating a grant initiative to help our people get where they need to be.
Telemundo.
Yes, Ms. Avegno, how do you address the rumors? We keep hearing that people with O blood type are less likely to get. So how do you address that?
Yeah, this is one that has been, circulating on and off for months in the pandemic. There is no good evidence that has been, shown in actual human sort of head-to-head that a particular blood type makes you more or less susceptible. There has been some, studies, but it really isn't a fact. Most people don't know their blood type. And so I wouldn't recommend finding out your blood type and saying, well, if I have this, I'm okay. I would recommend that everyone with any blood type assume that they are susceptible and get the vaccine as soon as they can.
WDSU followed by WGNO.
Yes, either one of you guys can answer the question, but what are the concerns with our neighboring border states opening up their populace to not even no mask mandate? As we know, you get a lot of business from both parties.
Well, you're asking, it's unfortunate, in terms of the leadership and the lack of leadership in those areas. However, for the city of New Orleans, we will remain, as you have heard from us, in terms of wearing that mask, keep your distance, the large gathering sizes and the like. And that's what we're called to do, and that's what we're promoting. And when you come to the city of New Orleans, you will be required to do just as we are here in terms of locals. Dr.
I
Vagno?
think you're seeing a lot of pushback in the cities, in those states, from businesses saying, we are going to maintain the mask mandate. I mean, it flies in the face of CDC and White House recommendation. The CDC just came out earlier in the past week with a study showing that mask mandates significantly reduce cases and hospitalizations and deaths and all the things that go along with them. So, why you would want to go against that, it's very solid advice. I'm not really sure, but I'm grateful that we are keeping ours in place.
WGNO.
Two questions. Dr. Vagno, are there any precautions against women trying to conceive getting tested?
Yeah, that is a great question, and we've heard it. There is a lot of rumor going around that the vaccine makes you infertile. There is absolutely no evidence to suggest this. There is no vaccine in use that has that effect. So, this really is a very insidious rumor. The vaccines are generally not studied on pregnant women because we don't test drugs on pregnant women, largely because we don't, want their even theoretical risks. You just don't want that. So there are things we don't know. However, the vast majority of obstetricians, gynecologists have come out strongly supporting it. And indeed, pregnancy is a condition that allows you to get the vaccine. What we know is that pregnant women who contract COVID are significantly more likely to have severe complications and death. We also know it can potentially be passed on to the newborn. So the risks are huge. But that unfortunately has sort of seeped into being one of the myths, and we do not have any evidence to show that it has anything to do with fertility. Every woman and her partner should talk to their doctor if they've got concerns and just sort of work through it with them.
My second question was, it appears, and I could be wrong here because we asked about the musicians and entertainment. I don't know if this is entertainment or not, but are we able to have jazz funerals? Outdoor.
So
Most times less than 150 people. So I don't know if
we still, parades and second lines are not allowed. Are you, if you are asking, can there be music at an event, those with a special event, with a permit, if they meet the guidelines, there would be a pathway for music at a particular event. I think.
Just a few more questions. WWL, WDSU, and the Advocate, one question each.
If you all did have to roll back things at some point in the future, are you now looking at just hospitalizations and cases or one or the other? Is there kind of a difference of thinking now that vaccines aren't here?
We're looking at it all.
Yeah, we're looking at it all. We're just getting to the point where hopefully we're going to start seeing, we know that our elders have been vaccinated to a higher degree, of course, than the rest of the population. We're really looking with interest to see what's that doing to hospitalizations, deaths, right? Because they're most at risk. So talking with my public health colleagues, we've always been focused on hospitalizations and deaths, and so we're going to continue to do that. That's not to say that the number of cases, if it shot up to 200 again, wouldn't cause us concern, or if the percent positivity rate went sky high. But yes, that is as important, if not more important than it was.
And you mentioned that the seniors, it made me tickle a little bit, laugh a little bit, because what we're seeing with them is that they're saying, hey, we're all vaccinated. We want to get back to that water aerobics. What's going on? So it's presenting just a different challenge that we're going to meet, that challenge, but to give them the level of accessibility that they want, because they're saying, hey, we're all vaccinated now.
The issue?
So here's a question for you, Mayor. It's no secret. During this process, you even joke about this, you're being criticized by some of the memes and the gifs about things that you've done. But when you look at the numbers, the low positivity rate, the lowest in the state, and the fact that we're doing more vaccinations than the country, do you feel vindicated in some way over what you've done? And what would you tell the critics who have criticized you along the way and put up, as you like to say, the memes and the gifs and,
Well, I love the memes, you need to laugh. you know, and I have thick skin. I can laugh at myself too. But at the end of the day, making the right decisions and the tough decisions to move this city along. And so with the data, and as it reflects that we've done the right thing, we've made those tough decisions, and we have saved lives as well. So we're moving in the right direction. I'm focusing on a full recovery of the city. That's where my focus is now, that road to recovery. So I can't, you know, I don't listen too much to the naysayers. If I did that, it would knock me off guard, keep me unfocused. And my role and my job is to stay focused and lead the people of this city. That's what I'm committed to. So the memes, they just give me the motivation to laugh and be connected, you know, to our people. And it's, you know, you just, it's a part of who we are. And I think what's also been demonstrated, we have more comedians, you know, in the city of New Orleans than I ever even imagined. So I'm hoping that, you know, with this content that they're able to create, that we make our little mark, not only in the city of New Orleans or the state of Louisiana, but our comics on the national level. I think it's an opportunity there.
Last question, the advocate.
I think just looking at this comprehensive set of guidelines, this is the most open we've been in the city in a while, for a year and a day since the pandemic restrictions happened. When is the earliest that we could expect to see a return to second lines, a return to parades? You know, we're on St. Patrick's Day.
Vaccinations.
That we haven't had a St. Patrick's Day.
Yeah.
I'm just curious to know when you guys think we should be able to go back to that.
Yeah, I miss the cabbages too. But yeah, that is a question, and it's interesting that came up on our national call last night with Dr. Fauci, trying to understand where the intersections are, and everyone across or at least the you know, the leaders that I'm in contact with, they're trying to really do this right and really be inching forward rather than open and shut and open and shut. We've seen that that's not. So we are doing some modeling that's going to help us, I think, understand what will be safe at a level of X vaccination, at a level of Y gathering sizes, Z masking, right? What things are safe and possible. And again, you know, we understand we're not, you know, there are people out there who want to get to zero. We're very realistic. We're never going to get to zero coronavirus cases. Coronavirus is here. It's not going away. If we can get to zero deaths, that's what we're shooting for, and zero or close to zero hospitalizations. So, you know, everything is just understanding what the risk is, and what the benefit, not just from a health perspective, but from a mental health perspective and from an economic perspective. So no one, I'll tell you, no one across the country knows that, and it has to be contextualized for each city. You know, what New Orleans needs is different from Chicago and Seattle and all that. But we're all trying to sort of wrap our arms around models that would help us show what the progression is.
Get vaccinated.
Yes.
Madam Mayor, no other questions.
And laminate your card. That's what I'm going to do today. Thank you all so much.